Welcome to the Western North Carolina School of Massage. My name is Dr. John Morgan, and today we're going to learn treatment of tennis elbow, medically called lateral epicondylitis. This is the epicondyle of the humerus. The lateral one is here, and the medial one is here. And this is a common attachment site for the extensors of the wrist. This would be wrist extension. Lateral epicondylitis actually rarely involves inflammation of the epicondyle. Like other conditions called tendinitis, it's actually a collagen breakdown in the tendon fibers here, so it's accurately called tendinosis and is not actually an acute inflammatory condition. So in order to heal this condition, we must reduce tension on the damaged tendon fibers and some reduction in hypertonicity of the associated muscles, which would be the extensors of the wrist. Primarily extensor digitorum longus, and wiggle your fingers. You can feel it undulating under your fingertip. And then just moving medially, there is extensor carpi radialis brevis. Moving laterally here, you have extensor carpi ulnaris. Extensor carpi radialis brevis is most affected with tendinosis. However, all the wrist extensors could be involved in this condition, as well as brachioradialis, which is a elbow flexor. Go ahead and flex your elbow. There you go. Go ahead. Resist. Push. There you go. And right there is the brachioradialis. Thank you. Often involved in tennis elbow. So we're going to apply some lubricant. And because this condition is primarily due to excessive hypertonicity, reducing muscle hypertonicity is a primary goal. And we begin with gliding strokes over the extensor digitorum, right here in the middle, extensor carpi radialis brevis, and extensor carpi ulnaris. Most of the muscle tissue is located in the proximal 2/3. The distal third of the forearm is mostly just tendon. So we want to focus most of our pressure on the proximal 2/3. You can do this gliding stroke with your fingers, open fist, or even forearm. The pain someone typically experiences is at the lateral epicondyle, and trigger points can develop in the muscle fibers that would refer down to, for example, trigger points in the extensor carpi radialis brevis can refer down not only to the lateral epicondyle but to the dorsum of the hand. That's the back of the hand. Extensor carpi ulnaris can contain trigger points that can refer to the wrist. And extensor digitorum all the way to the fingers. The common complaint a client will have is a painful, weak grip. They'll come in and say that they drop their cup of coffee, or they can't hold on to things, or when they go out to garden or pull weeds or use a hand trowel, their lateral epicondyle hurts. Playing tennis with a heavy tennis racket, using scissors or pruning shears, anything that involves a grip. How would you know? Well, they're going to come in and complain of pain here. You can also have them extend their wrist under your resistance, and it's going to hurt right here. Okay. Now, Because this is basically a breakdown of the collagen fibers here due to hypertonicity in the muscle, not only do we want to glide and lengthen and reduce muscle tone, but we also want to come up to here to the lateral epicondyle and do some frictioning techniques to stimulate fibroblast cell proliferation. And fibroblasts are the little cells that make connective tissue. They make up our fascia. They produce collagen, little protein molecules. And they'll help to rebuild the breakdown of collagen at this attachment site, which is a very common attachment site for all the tendons of the wrist extensors. So again, any type of excessive overload or overuse of the wrist extensors can contribute to this, such as data entry, typing on a keyboard, playing the piano, and so while this is in the resting stage, you want to encourage your partner to do just that. Rest. Reduce the activities that caused overload in the extensors. So again, we're doing deep friction here to stimulate collagen growth and repair the degeneration that was occurring. Now, the extensor carpi radialis brevis can also entrap the radial nerve, which would cause numbness and tingling down to where the nerve innervates. And the radial nerve innervates and supplies the thumb, the back of the thumb, the back of the index finger, and this side of the middle finger with sensation. So if a client comes in and you say, wrist extend, if it hurts here, that's typically going to be an indication of muscle pain and lateral epicondylitis. If when you do this, they experience just, it's very weak and you can press it down easily, or they experience numbness and tingling or paresthesia along the fingers, that's an indication of radial nerve entrapment. Radial nerve entrapment by the extensor carpi radialis brevis is still treated with some compression here to alleviate muscle hypertonicity and get the muscle to relax and no longer entrap the radial nerve. Then we could do some broad cross fiber friction over the muscles. And you can feel the thicker extensor digitorum here, and you want to be fiber specific when you do your gliding strokes and stay just on each specific muscle. Digitorum, carpi radialis brevis, and right there's ulnaris. If the lateral epicondylitis is not too severe, you can also do some active engagement of the muscle. Some contract relax stretching. So we put the muscle into a stretch, ask our partner to resist, go ahead and extend, breathe in, 1, 2, 3, 4, 5, exhale and relax, and then take it further into a stretch and push again and breathe in, 1, 2, 3, 4, 5, exhale and relax, and then take it further into a stretch. This is called a post-isometric relaxation technique and will help to reset the muscle to a longer resting length. And you want to encourage your partner to continue doing that at home. The other muscle that's commonly involved and develops secondary trigger points is the brachioradialis, a common elbow flexor. Go ahead and flex your elbow, and you can see it pop up right here. Thank you. It attaches to the lateral supracondylar ridge of the humerus all the way down to the styloid process and flexes the elbow in neutral. This is supinated, this is pronated, this is neutral. So any kind of lifting activity will also overload this muscle. Its trigger points also refer pain to the lateral epicondyle and then to the base of the thumb, both anterior and posterior aspect of the thumb. Treatment of this muscle is with pincer compression and gliding all along the length of the muscle belly, which is the proximal 1/3. The distal 2/3 is mostly just tendon. Please remember that tendinosis is a slow healing condition, so encourage your partner to be patient and consistent in their efforts at home in stretching and resting, and to be consistent with their treatments in the massage therapy room. Recommend that they rest, maybe apply some moist heat if it's not too severe. There's still some controversy about compression wraps here. Whether they help or not is still up for debate. And this is the basic treatment of gliding strokes, compression and friction to the attachment site, stretching and contract relax post-isometric relaxation techniques, rest, and moist heat if it's in a chronic condition. For tennis elbow, lateral epicondylitis, actually tendinosis and breakdown of the collagen of the elbow. Recommend at least once a week, 1 hour therapy for 4 to 6 weeks, and then reassess.